And we are thrilled to have our own Jerry Antimano, who heads up our community management and development at HITLAB. Next up to interview and talk with Anna Lisa Somera from Rhaeos about what she's doing and what Rhaeos is doing and their community is doing along the lines of addressing the gap in hydrocephalus diagnosis for improving, again, thinking about getting a digital health technology up and running in some of the wealthier countries so that we can get into some of the lower income countries at the end of the day as well. Jerry, it's all yours.
Cheers, Sam. Thank you very much. And it's wonderful to be with everybody for the final Digital Health Symposium for HITLAB for 2022. And it's my pleasure to welcome on Anna Lisa Somera from Rhaeos. Anna Lisa, thanks for joining us. I'm sure the audience would love to hear about your background and the journey to Rhaeos.
Thank you. So happy to be here. Appreciate the time and also the attention on a condition that you may not hear about, especially in mainstream media. So Anna Lisa Somera, CEO and co-founder of Rhaeos, and Rhaeos is it was formed in 2018, and what we're doing is that we're developing a wearable skin sensor that is here in my hands, and what it can do is it can detect bodily fluid flow beneath the surface of the skin. So think of things like blood, of course, lymph, and in the case of our first indication, cerebrospinal fluid in a chronic medical condition called hydrocephalus. Some of you on Zoom today might be wondering, what's hydrocephalus? So what it is, it's characterized by excess cerebrospinal fluid or CSF on the brain. There's no cure for it. Once you have it, it's a lifelong condition. And it's often treated through neurosurgery, through the placement of something called a shunt that drains the brain of that fluid. And there's no technology available today that can easily assess how that shunt is performing. So there's a lot of guessing game with imaging, which doesn't give direct information about the flow. Also, invasive neurosurgery is kind of also used to kind of check to see if the flow is working. So what we're doing at Rhaeos is we're presenting this non-invasive wearable digital solution launching in the hospital first that can assess and quantify the flow in a matter of minutes. So it's skin surface contacting. We put it right on the skin over the shunt. You can palpate it around the clavicle, and in a matter of minutes, we can let the clinician know if there's flow or no flow. And we're also developing a home-based device. So parents, patients can have peace of mind, on their shunt.
That's incredible. Such a worthwhile innovation for parents and kids alike, of course. Of course, as it says up here, you were a Breakthrough Alliance Challenge finalist, and I think ultimately a winner from the challenge. It'd be wonderful to hear, and it's always great that we're able to catch up with our finalists and winners from these different challenges that we're able to do. And what advancements, what news do you have to share with the audience who may have seen you present at the challenge in June?
Yeah, definitely there has been a lot of updates on Rhaeos' side since winning the challenge. I think first this is huge. We kicked off our pivotal study that's needed for de novo 510(k) authorization. So that's what's needed so that we can market our device next year. So it's this massive 10-center study that we kicked off since winning. So we're working with really great key opinion leaders across the country from coast to coast. So UCSF and Stanford, all the way to Duke. These are, the trial is going well, looking to wrap it up, fingers crossed, all goes well by the end of the year. And then we'll, submit our regulatory application. And the plan is to be on the market with our hospital device that can be used bedside, in the first half of next year. So that was, really big news and a huge milestone for us. I think, other big news too, is that we exhibited at 2 conferences. So it was the first one was at the Hydrocephalus Association's, conference, which is great because we got to interact with patients and neurosurgeons. And it was a conference solely dedicated to hydrocephalus. So, our stakeholders were there. So that was our first conference debut in Austin and in July. So that went really well. And then more recently, we were in San Francisco for this huge neurosurgery conference, CNS. That went well too. And we had, so many visits to our booth, great meetings with various stakeholders, and we're gearing up for the next conference. We're going to be in health, the big, kind of digital health conference in Las Vegas. And I think it's in a couple of weeks. So we'll be there.
Yeah, it is. It is. Look, I think 2020, well, the end of 2022 at least is looking like it's going to be the time for everyone to start getting back into person. Seeing each other and sharing ideas face to face, around different innovations and stuff. So I'm really glad you're getting out there and getting in contact with everybody, in person and stuff. That's absolutely terrific. And in terms of hydrocephalus, and you mentioning that it's something a condition that's not really widely known or widely well diagnosed and stuff, because of course that we're looking at digital health and human rights for this particular symposium event. What are the plans at the minute and in the future for Rhaeos to address diagnosing hydrocephalus, especially in areas and regions where it's not as easy to come by diagnosis tools?
Yeah, absolutely. So, the ultimate goal of Rhaeos is for our technologies to be available to anyone wherever they are, irrespective of what they can afford or not afford. So we're initially launching in the US. Our trial partners are here looking to, launch the hospital device first. And, we also have a wearable, a home wearable for remote monitoring to give patients ease of mind, wherever they are. And that'll be, that's on track for launch in 2025. There's with this hydrocephalus population, even, especially since it's, not really well known, I think also not well known is the fact there are huge domestic, racial, and ethnic disparities in health for this, particular condition, where, African Americans and Hispanic Americans are, disproportionately more affected, both clinically and economically, by this condition than the rest of the population. That also mirrors outside of the US, particularly in low to middle income countries. So, regions like, Africa and Latin America, have, a significantly higher population of hydrocephalus, congenital hydrocephalus. So, patients that are born with this condition. So, we are, actively, looking to, bring our devices to these patients who live not only, several hours away from the hospital, but even days away from the hospitals. We're looking at regions like, Uganda, especially where, they can really benefit from, kind of our, remote monitoring, because if we can detect early if something's going on, then they can get to the hospital sooner, because like I said, sometimes it takes several hours. And for a lot of, these folks in these regions, it can take several days. So it is our mission. It was our mission from the start to, find solutions for, these patients wherever they are in the world.
No, that's terrific. Yeah, definitely. Prevention rather than cure is sometimes the best way to look at your solution, especially in those in those parts of the world where access is not as easy. So
absolutely.
Really, really wonderful. Really, really wonderful to catch up with you, Anna Lisa. Thanks so much for coming on and giving us an update of how you've been doing. And if you are going to HLTH, anyone in the audience, do check out Rhaeos at the event. Thanks so much for coming on, Anna Lisa. Wonderful to catch up. Stan, back to you. I believe you got a book giveaway and some more information about Breakthrough.
That is correct. Yeah, we're excited. As you all know, Rita McGrath is one of our favorite professors at Columbia Business School in the Columbia Business School Digital Health Program in strategy. And Rita has a terrific book on the entrepreneurial mindset which is one of the, really, when we start thinking about developing and having growth digital health technologies, it's the entrepreneur that starts it all. And so it's critical to read this book. It's critical to understand the entrepreneurial mindset. So Rita has been generous enough, and I'll be talking with her later today, to actually donate some books. And we have a giveaway not only here today, but also through Instagram. So we have a trivia competition, of course. And so the trivia question for this book giveaway is, what is the key international statement of human rights today? International Code of Human Rights, A; B, the International Covenant on Civil and Political Rights; or C, the United Nations Universal Declaration of Human Rights of 1948. And we've got some answers coming in. Andrea Timberlake has already come in, and the correct answer is C. It looks like Martin, outstanding Martin, has won the book giveaway this today. And again, congratulations on that. We'll connect you up with the team to get you the signed, personalized copy of that book very quickly here. And next up as well is, don't forget, the Breakthrough Challenge has been extended. The deadline is now tomorrow at midnight Pacific time. So don't forget, if you have a startup or know someone with a startup, or even a early commercial company in digital health, the Breakthrough Alliance sponsors these breakthrough challenges every semester. And we're thrilled to be able to offer studies and promotions and connectivity as a part of that.